If you or a loved one have been told you may have testicular cancer or you do have testicular cancer, it's obviously terrifying to hear. It's a very rare disease, but there's some good news embedded within that. It has the highest known cure rate for any solid cancer in men. So when I meet with these guys newly diagnosed with testicular cancer, there's a lot of detail that goes into the conversation. But we always start with these 4 words: this all ends well. And for the overwhelming majority of these guys, the cancer is not going to be a long-term problem for them, and they're going to live a full, rich life. Now, if you suspect you have testicular cancer, the most common way guys find out is they feel an abnormality in their testicle. I always recommend they get an evaluation by a physician. There are false alarms, there are non-cancers that can be identified, and it can provide reassurance. But if you think it's a cancer, definitely get it checked out. It's usually an ultrasound and some blood tests. And if it is highly concerning for testicular cancer, the first step would be removal of the testicle and analysis under the microscope. If you're interested in fathering more children, the good news is the other testicle almost always is sufficient, but it's always worth considering banking sperm either prior to the removal of the testicle or after. If you've been diagnosed with testicular cancer, there's 2 main categories of testicular cancer: seminoma and non-seminoma. And all decision-making after removal of the testicle relies on 3 things. What does the cancer look like under the microscope? What do your blood tests show both before and after that surgery? Most specifically, 2 blood tests called the AFP and beta-HCG. And what do your scans show? Has the cancer spread throughout your body? If the cancer is limited to the testicle, normal blood tests, no spread elsewhere, the most common strategy is surveillance, no further therapy, and the long-term cure rate is 99%. There are situations where it hasn't spread elsewhere, where we'll also discuss other options, such as a short course of chemotherapy, radiation therapy, or surgery to lower the likelihood of the cancer ever returning. If the cancer has spread to the back of the abdomen, which is the most common place it can spread, there's a lot that goes into that discussion, but often either chemotherapy, radiation, or surgery are recommended. If the blood tests remain abnormally elevated, or there's bulky spread to the back of the abdomen or spread to other parts of the body, then chemotherapy is the first step in treatment, and sometimes the last, although there are some men after chemotherapy who do require additional treatment, most commonly surgery, but sometimes additional chemotherapy, to do everything possible to get them across the finish line to a long-term cure. If you have testis cancer, based on its rarity and complexity, I would strongly recommend you visit with someone who understands the complexities, details, algorithms, possibilities, and nuances of the disease.